It's for information, it's for educational purposes only. You have the right to choose how you're going to utilize the information.
Amen.
And I will say that this information, I've utilized it and seen wonderful miracles. Because God's ways work. Alright, now that we've gotten that over with, I want to start with, I'm going to ask this question. What did God promise to do? I think, what did God promise to do when we apply these simple methods? Let me see. Okay, okay, this is where we're supposed to start. According to the pen of inspiration, what responsibility did God give believers when it comes to dealing with sickness? I remember years ago, I don't remember how long it was, but it was quite a long time ago. I was visiting a family, and I was there for a week, and there was a gentleman in the home. He was in his, I would say maybe mid to late 50s, and he was a construction worker. And one afternoon when he came home from work, he said, I need your help really badly. And he pulled up his pants and showed me his knees, his right knee was swollen and red.
I know 50-something.
And he was actually limping. And he said, you know, this is really affecting my work. I could hardly move around with it. And I said, okay. And I showed him and helped him to apply a hot and cold fomentation to his knee. Now, mind you, he was limping, groaning, etc. So we did that for 3 evenings. Whenever he will come home from work, we'll do it. And by the fourth day, when he had left very early, and when he came home the afternoon, he said to me, I want to show you something. And he ran up the stairs and ran down back. He said, whatever you did is gone, the pain is gone, and the swelling is gone. And it was a simple hot and cold fomentation to the knee. I remember another time, and I'm going to give you some extreme cases. Another time, I got a call from a church sister. She told me about this lady. She's 70 years old, and she said the lady has very bad arthritis. And recently she went to her doctor, and the doctor said to her, I cannot give you anything stronger. And she said, but I need your help. He said, what do you want me to do? And he repeated, I cannot give you anything stronger. So she went home. She was depressed and basically hopeless. And so I made an appointment for her to come and see me. And when I saw her, she was walking with 2 canes. And when I saw the pain, I told her not to even come. We're going to come to your house and work with you. 1 month later, well, her house, she had a house. There were 3 floors. You had the living room and the kitchen, and 1 floor, her bedroom upstairs, and in the basement where she had her washing machine and dryer, that was in the basement. So when she came down from bed in the morning, she did not go upstairs anymore until it was time to go to bed, because she was in so much pain. And she had to hire someone to come and take care of her, to do things for her, cook and clean and wash, etc. Well, we worked with her, and about a month later, she said, my daughter just came to visit me from Maryland, and I would like for you to come see her. I'd like for her to, she wants to meet you. And I said, okay. Came over, and the first thing she did when I walked into the house, she said, look at me. And she walked up those stairs, and she walked down those stairs, and she lifted her hand, and she was just shouting, hallelujah, praise the Lord.
Amen.
Again, because God's ways work.
Amen.
Yeah,
Amen.
this lady, within 1 month, she moved from hopelessness to freedom of pain and just rejoicing in the Lord for what he did for her. So with that in mind, I would like to talk about the first remedy I'm going to share with you, and it's called a hot and cold fomentation. Now, hydrotherapy has been records of hydrotherapy goes back to thousands of years, 2, 3, 4,000 years. In almost every different culture, this was practiced. The Romans, the Greeks, and this was part of the what we will call conventional therapies. Hippocrates and others did it. They promoted it. Then, as we come down to our time, we have Dr. Kellogg and others who brought it back again and made use of it and promoted it. Now, the theory behind the use of water is one of the most effective agents in healing and preventing of sicknesses in a lot of different areas. But we're not going to go deep into the science of hydrotherapy. We're just going to do it. We're gonna just make this a practical lesson. So how is the hot and cold fermentation applied? And for me to do this, I'm going to need a volunteer. And we're going to do a hot and cold. We'll demonstrate how to do a hot and cold fermentation to the knees. So, yes.
Yeah, I really have a new problem
yes,
here,
you can come.
Quite literally.
We're not going to do it live, but we're going to do a demonstration to show you how it is done. So you can just lay anywhere you want to put your head.
Hey, make sure that
The continue with?
Yeah.
Make sure that table is strong.
Yeah. I think it'll take up to 300 pounds.
Close enough.
Okay, good. So you just lay down. And let me make a pillow for you here.
Which is the knee? The right one?
The left.
Okay. All right. Let's put your hand.
You were rocking, Victor.
I need a bowl. Did we get a bowl? Did we bring a bowl?
Yeah.
You
There's
didn't
one
follow
right
my
there.
instructions. So I need I wanted a plastic bowl. Yeah. One of those ice cream buckets for those of you who still go to.
No, it's not that big.
What is that here?
Yeah. And are you comfortable?
Very.
Wonderful. Well, when we are done, you're supposed to be running and jumping.
Praise God.
Actually, when you do the bowl. All right. Sorry. This will work. So here's what we need. We need some towels, right? I like to use large towels, and I like the big. For this, we use a large towel. For those of us who are considering doing this health evangelism, this ministry of healing, there are certain things that we must have. And one of the things that you must have is a set of large towels, large bath towels, between 4 to 6 large bath towels in your home. It's important to have a bucket. All right. You can get the compound buckets.
Yeah.
They work very well for doing hydrotherapy. Okay. Besides the towels, you want to have a basin, a large size bowl, or I say like a 2 or 3 quart bowl, because that is what you're gonna be using for your ice water. Your ice cold water will be part of your hydrotherapy, so you need to have a bowl that you can put ice water in, cold water with ice cubes. Besides the large towels, you have a set of small towels, washcloths, and so forth. Okay, those any smaller kind of towels. All right, and let me see what else you need. It's good to have a pitcher that you can pour cold water. Most times we don't have one, so we use like when you're doing a hot foot bath, you're going to finish it with cold water. We usually would use the same bowl or basin that we do have the ice cubes in. Okay. So to do the fermentation, now I know most of you don't use a microwave in your home, but it's the best way to heat up towels. It's the quickest way to heat up towels when you're doing
You wet it first in the microwave?
Yeah, I'll show you how to do it. So before I knew of the microwave, I would get a big pot. I'll get a big pot full with boiling water, and then you will do it, and I'll show you how to do that. But the microwave, I've even done it in the oven, wet it in the oven, wrap it in foil and put it in the oven, but that takes long, and it doesn't get, it maybe 20, 40 minutes, and then it's not that hot, and it gets cold faster.
If you have a wood burning stove, would the top of the stove work?
You gotta put water, but if you have a wood burning stove, then you put your, I've done it on a wood cook stove too, and I've used a cannon pot. A cannon pot is just a perfect size for doing hydrotherapy, because it can hold very large towels. Most people don't have a big pot in their home, but I always recommend having a big pot in your home for doing hydrotherapy. A cannon pot is perfect because it's wide enough. And I found the easiest way to do it was on a wood cook stove, because you have a wide area to get heat from. Okay, I need someone to hold this mic for me.
You want the headset?
Oh, the headset would be much better. Yeah. So while we're waiting to get our headset, do you have any questions?
So hydrotherapy works for like a tear in the knee?
Well, I have had someone that had a like in a torn meniscus. See, when you're dealing with those kinds of injuries, it's always good to check with your doctor to make sure, because there's some kind of injuries, heat is not the best thing. There's some injuries where cold is better. So it's always good to check with your doctor to determine if the heat or the cold will work better. Because if it's not the right temperature, it can cause more injury.
And what about people who have, I think maybe the ligament worn or something, and the bone is rubbing against
that again, you have to check with your doctor to make sure.
Oh, yeah. So this is just for like arthritis?
Yeah, this can go beyond regular inflammation and swelling. But in other cases, check with your doctor, because there's certain kinds of injuries that can be aggravated by heat, and in that case, cold will be better. And once you're told which is better, then you just apply it. Okay, all right. So what we do, so this is our pot, because we don't have, I'm going to show you the pot method, because we don't have a pot. We're going to pretend, and remember, we're pretending this is a pot with boiling water. When the water starts to boil, and I find an easy way to fold the towels, the best way to do it is to fold the towels like this. Okay? And then you twist it. And the reason, anyone knows the reason for twisting it?
It keeps it easy.
No, it's easy to wring it out.
Oh, that's what I was thinking.
Yeah. Right. When you fold it, twist it like this. Now remember, this is very hot water, so yeah, so it's very easy. So the water is boiling, right? It's a rolling boil. You dip it in there, 3-4 seconds, get it soaked, and then all you do is pull. Okay. You don't have to wring, you just pull, because it's already twisted in a wringing position.
When you stop watching it,
you gotta have fingers like mine. I've done it for years like this, and then I discovered these gloves that I was working with a lady, and her husband worked in the subway doing cleaning, and he had these big rubber gloves. So then after that, I'd go to the industrial store and buy those thick gloves, and those work better. It's easier to use. So I'm going to put that in here, right? I'm going to leave it right there. Now, the water is empty, so it's good. So now,
You have hot water behind?
Question.
Yeah,
How big should the pot be, like on average?
like a 12 quart.
A 12 quart?
Yeah.
At least.
At least, yeah. Because you want it big enough where you can put those dip the towels in and you can have enough water. Alright, so now in this home we are using what we have. The ideal thing would be to have 4 large towels. But we don't have 4 large towels. We have this towel here and it's very thin. So what I'm going to do, I'm going to try to get it in 4 layers. Okay, that's 2, 3, and I think we can get another one, right? Almost. So I'm going to put it underneath like that. I can do it like this too, but after a while I may want to remove a layer, and this is going to be difficult. Okay, but again, this is all I had, so I'm going to put it there. Because if anything, I could always remove it like this. Okay, but usually this is the way we will do it. We do the 4 layers like this. If you don't have a large towel, you can use small, and you have a small towels, then you can use 2 or 3 small towels. Okay, but this here we're assuming that we have a large towel. So what we do now is that has been wrung out. Now remember, when you're doing this, you want to have this done first. Everything must be prepared.
This would be a dry towel, sorry.
This would be right. This would be a dry towel, and you carefully wring this out. And then you're gonna fold this. Like this, and then you put it over the. Now this is not hot, so I can handle it like this, you know. But
Under normal circumstances.
under normal circumstances, yeah. I mean, my fingers have gotten so used to the heat that I can handle it in a way most people can't.
So the other towel is hot too, right?
No, dry.
No, this is dry,
Okay.
and this is hot.
Okay.
And then you put another dry towel over this.
Oh.
Contain the heat.
Yeah, to contain heat. And what I do, I put a plastic bag. I get a trash bag, and I put the trash bag over this. As a matter of fact, I usually put the trash bag over the wet towel, and then cover it with a dry towel. The plastic bag helps to keep in more heat for a longer time.
Yeah.
Okay, so now I'm going to set my timer for 3 minutes. Okay, I set my timer for 3 minutes, and while my timer is going, this bucket or this will be a bucket or a bowl, and there'll be ice cold water in here.
Ice inside it?
Yeah, ice and water, ice cubes and water, and then this is here. Now when I start this, I'm gonna ask him to is that too hot? Is it good? If it's good, sometimes if it's a nice good towel, thick, these layers. I'll tell you, if I were doing this, if this was really being done, this towel will not be enough, because this towel is thin. It will not be enough. But so what I'm going to do, but this is all we had. So what I'm going to do, after I put this, I'm going to ask him how is it, if it's too hot, if it's not too hot, if it's comfortable. If it's too hot, then what I will do, I will get something, a t-shirt or something, and put on it there. If we have more towels in the house, I will add another layer of towels there. Okay? Because you don't want it too hot, but you want it hot enough that a person can bear. Let's say for some reason or other, it is not as hot. It is not as hot. He's not feeling the heat, and you want to give it. You want to give it a few, maybe a minute or so for the heat to go through. Sometimes you might not feel the heat right away, but within a minute, the person will say, "Oh, it's getting too hot," and then what you do is you remove this and put another layer. Sometimes rubbing it alone will cool it down a little, and so, like I said, if it's too hot, if it's not hot enough, then you reduce a layer and you put it there, if that's not hot enough. Okay, but that was hot. That was hot. So we're just gonna leave it like that.
Question.
Yeah.
Is this the first dry towel is applied on the bare skin or is it the
Yes, on the bare skin. The first dry towel will go on the bare skin. Okay. So my timer went off. It's 3 minutes. So what I'm gonna do, I'm gonna ring this, and you don't want to put this on his feet, right? You don't want to put this on his feet. So we're gonna put it here. Can I use this? Is it okay? Okay, good. So I'm gonna I'll wring out the washcloth, and I'm gonna remove the towel and briskly rub the area with the coal, and then I'm gonna dry it with a dry towel, and then put this back on. Okay, then I'll set my timer for another 3 minutes.
Why you dry?
Because once there's moisture there, it's more hot. That will make it more hot than it should be. Yeah. Okay, so that's the reason why you dry. So now I've set my timer for 3 minutes again. When the timer goes off, I wring this out, remove it, and I rub it again, dry it, and then put that back on. You can do this for about 5 changes of heat and cold. Yeah, 5 cycles. Yeah.
What is happening with the blood on the skin when you...
Okay, the blood is moving. Excuse me. The blood circulation is increased, and everything else that's needed for healing is increased, and that reduces the inflammation, the swelling, and thus the pain is lessened. I've seen amazing things happen with hot and cold treatments. I've seen people with bursitis experience relief with doing that. Some people, there's some situations, all you need is one hydrotherapy remedy. Some situations you may need to do it for 4 or 5 days, some 3 days. Like the gentleman that I told you about, within 3 days, he was doing great. I did it another 2 days, however, but that's how some people, they will do this twice a day, in the morning and in the evening, and see wonderful results. You have certain situations where it will take sometimes 3 or 4 before you see any significant changes. In some situations, after the first application, you will see significant changes. So it depends on how bad the situation is, but you will see some changes. All right. So now another thing you want to do is you want to check with the person. Is this getting cool? Is it cooling down? And if it's cooling down, you could reduce some layers and put that back there. If it's not cooling down, you just leave it. If it's usually the person will tell you, okay, my knee is feeling better. Then, and if the towel is nice and hot and is covered properly, you will just need one towel for that 5 cycles. There are times when I have to heat up another towel and do it again.
Question.
Yeah.
You could use foil instead of plastic to keep the heat?
Yeah, you can use foil. Anything that will keep the heat.
Sorry, man.
How long should the cycle naturally run? Like half hour?
20 minutes.
Okay.
20 minutes are good.
For the 5 cycles?
But the 5 cycles will run you about 20 minutes. Yeah. And okay, so now we have done this. We have done our five cycles. Our last 3 minutes are up. So I'm going to wring out my washcloth again. And then I'm going to do one final rub with a coal, one final brisk rub, and then I'm going to dry carefully. And that's it. And that's it. So he will be ready now. Yeah.
You can walk.
He can jump, all kinds of things. I've done live demonstrations like this.
I felt the heat one is covered. It felt actually good, but just with the towels.
Just with the towels alone, right? Yeah. Heat is amazing what it does. I've done live demonstrations in churches and settings like this, and people will get up and they'll be testifying just after one application.
So, question.
I'll take this.
For for the knee, what about the situations where you have ACL tear and...
Like he said, he had to
No, you
consult.
check with the doctor to make sure. Because there's sometimes...
What if it is an ACL tear? Is that...
Well, it
It
depends.
probably might need surgery.
Yeah, there's some things you need surgery.
Right.
You just can't get over
With
it.
like swelling and inflammation.
Yeah, I've known. I've known. I remember one lady. She said that she had a torn meniscus, and she wanted. She said, I want to do the hydrotherapy. She said, I'm scheduled for surgery, but I just feel I should do some hydrotherapy. And guess what?
No surgery.
She called me one day and she said, my knee is doing so good. I went back to my doctor and he said, you don't need surgery anymore. Yeah.
Amen.
Can you please repeat the last part that you said when the last treatment is up?
Okay, you just apply the coal as usual, the brisk rub with the coal, and then you dry it off. And always end with coal. Yeah.
Okay, for me though, I'm just here is the first time really seeing the demonstration that have been done.
Yeah.
But I just want to give an experience that I personally had, not having the knowledge of hydrotherapy.
Yeah.
I was having a very bad back pain till it reached a level where I was unable to walk. I'm lying on my back and I can't lift my foot. My foot could not really go up at all. There wasn't a lot of pain.
Right.
And I remember, I was praying and, I do all of that thing, praying and talking to God and stuff. But the Holy Spirit told me to get a container with a lot of hot water, boiling hot water. And I told the person to put salt in it. It was very hot, doctor. And they did what you did, squeeze a little bit and apply it to the back. And each time they get cold, they change it. They get cold, they change it. And they kept on doing it until they were frustrated in doing it. And I can just give God the honor and the glory. What has happened after that, through the moments, I passed that blue container you see right there.
Yeah.
The urine I passed would fill that.
Wow.
I passed a lot of urine. I don't know where that was coming from, but I just kept on passing urine, and when I go back, I just keep going because I wasn't able to walk, so I wasn't able to go to the bathroom. So I had a container there, like a gallon container, and that is what I was using to pass my urine, and it would really fill that bucket. And to God be the glory, since then I've been good.
Praise God.
But there was no cold going on there, but the heat did something. Therefore,
whatever you needed, it needed the heat alone.
the heat and the salt and the Holy Spirit, I tell you.
Yes. I've had experiences like that. You don't know what to do and you pray. And
Hot water is really good.
it is. Yeah, the hot water is a very good conductor of heat. And heat does wonders for the human body. Okay, so let's go to the slide. I totally forgot about this. Where's my clicker? Oh, here it is. So with that, so before we go to the next, you got.
I was asking a question. As she said, is it necessary, or do you have to add anything to the water, or it is not compulsory?
It's not necessary. There is something going on in her body. Could have been her kidneys or something. And that water with the salt was necessary. Yeah, I've had an experience once doing I did a hydrotherapy. My daughter was sick, and I did something for her. I had one of my first hydrotherapy textbooks, and I did something for her. She got better, and for years I went over that book, and I never found that remedy again.
You found it in the book but didn't find it back again.
Never found it again. And I looked, I searched, I was frustrated trying to find it. And I went through every page. I never find that remedy again. So I believe sometimes the Lord will tell us things that...
Question, with the hydrotherapy and the poultice, what's the difference? When will you use one in rather than the other?
It depends on the situation. Now with the knee, you can do a poultice with that. There are certain herbs that you can use to do a poultice on the arthritis knee or the knee with the whatever the injury is. So we'll touch a little bit on poultices today. Okay, so according to the pen of inspiration, what responsibility did God give believers when it comes to dealing with sickness? And here's what it says. Many should seek to obtain the education that will enable them to combat disease in its various forms by the most simple methods. All right, by the most simple methods. So what should they seek to obtain?
Education.
All right. That simply means that they should learn how to do these things. What did he promise to do when we apply these simple methods? It says, the Lord has given me light that when Israel of today humble themselves before him and cleanse the soul's temple from all defilement, he will hear the prayers on behalf of the sick and will bless in the use of his remedies for disease. Okay? When in faith the human agent does all he can to combat disease, using the simple methods of treatment that God has provided, his efforts will be blessed of God.
Amen.
And this is coming from the ministry of healing. I forgot to put the page. Thousands have gone down, oh yeah, it continued. Thousands have gone down to the grave because of the use of poisonous drugs, who might have been restored to health by simple methods of treatment. Water treatments, wisely and skillfully given, may be the means of saving many lives. Let diligent study be united with careful treatment. Medical Ministry, page 57. The Lord has provided antidotes for diseases in simple plants, and these can be used by faith with no denial of faith. For by using the blessings God has provided for our benefit, we are cooperating with him. He can use water and sunshine and herbs which he has caused to grow in healing maladies brought on by indiscretion or by accident. Alright? By indiscretion or by accident. Sometimes we don't know better, and there are times when we know better but we take chances. Nevertheless, if we understand God's simple remedies and apply them, we will see good results. Okay, so another way in which I've used the hot and cold fomentation is for respiratory problems, asthma, chest colds, and so forth. I'm going to share with you the first hydrotherapy remedy I did, and it was in 1976. When I was 11 years old, my tonsils used to be severely inflamed as a child. And at 11, my tonsils and adenoids were removed. After that happened, every cold or flu that came by, I got it. So I spent most of my childhood being sick, missing a lot of school, sometimes for weeks at a time. One day, after I would say about a year after I became a Seventh-day Adventist, I was walking home, and we had an Adventist hospital in Georgetown, and they sponsored a program called Radiant Health. Some of you might know that. And I think every Sunday or sometime of the week, they used to air that program. And so one day, I was walking home, and I love to read since I was a child, and I like to read. I always had a thirst for knowledge and information. So books to me was something that, books were like gold to me. So one day I was walking home, and I saw this book with a red cover laying by the side of a garbage can. I believe someone trashed it, and an angel came and took it out and set it in. Anyway, so I picked up the book and I opened it. I saw the title, Radiant Health. Well, you know, you growing up sickly, anything with health will attract your attention. You know, so I picked up the book, and when I opened it and read went through the table of contents, I said to myself, who in their right mind would throw away something like this?
In the wrong mind.
This was treasure.
They left it there for you.
Yeah. So I went home and I saw natural remedies for the common cold and for influenza. So that's the first thing I started reading. And I saw this remedy called fomentation to the spine. So I looked at it and I told my mom, I shared it with my mom and I asked her to do it for me the next time I'm coming out with a cold or flu. So an opportunity, one morning I got up and I was coughing and sneezing, so the opportunity came. And I told her, I said, you know, here's an opportunity for us to do this. So we read through it, you know, look at the instructions, and she did it. And that was the first time in my life I overcame cold and flu symptoms in one day.
Amen.
In the past, before that, I would catch the cold or the flu, and I would have and it would be followed by a bad sinus infection for maybe 3 weeks. And that was the first time in one day I ever overcame it.
Praise God.
And ever since, and I've learned others, but that one was. And I remembered Sister Petal, I don't know if she remembers, but one time I came to New York and I got a flu. I got so sick that I thought of calling an ambulance. I couldn't move, congested and really, really bad. And I thought about the fomentation to the spine. And I'm thinking, who can I call at 11:30 in the night to come and do a treatment for me? And I thought about Petal. She's the only friend I know I can call her at any time. So I called her, and she came, picked me up, took her home, and her cousin did the fomentation. You see, from the time the first application hit my spine, I started to feel better. And they did it for about 20 minutes. And next day, I was up and ready to go. That's how I always remember. It was weird. I was so sick that I actually smelled, you know how the mind works? I smelled what a hospital smells like. That's how bad it is. And then when I started feeling, then I know this is serious. I got to do something now or I will die. And that's what we did. The hot and cold fomentation to the spine. Yes, you are.
Just as you said, reading, mine was running on the infrared bulbs and those stuff. How can we use that important? If you know about, I know people talk about using infrared for heat also for heat therapy.
I've never used the infrared for heat therapy, but I think it can be used. I don't know. I don't know how to compare it with actually doing the moist heat.
Okay.
But you know, it may be worth a try, I guess. So I want to show now how to do the fomentation to the spine. And if I can have a volunteer. I see someone being nudged. No. Let me tell you something about the fomentation. Okay, good.
That table is strong for you.
Brave soul. If you can hold, you can hold him, right?
You shake your hand. You shake your hand.
Now, what I believe had happened to me that night, and this is and I can tell you, there's another time when people were dying from the flu. I remember.
He was strong, boy.
I don't remember what year it was. But we had, at the school that I was teaching at, our accountant, he had died. He had gotten sick, got the flu, and his wife took him to the hospital. And that was another story by itself. But that time the flu was going around really bad. So my students, I was teaching 3rd and 4th grade, and every day, Monday, maybe 1 or 2 of the students will come and tell me how they're feeling sick, and they'll describe to me. Tuesday, it will be another 1 or 2. Friday morning when I got up, I felt the same way that my students were describing to me. So I know that whatever they had, I gotten it. And my immune system was down because I was going through a lot of stress and other things. I'm going to bed late, etc. So my immune system was really down. And whenever, I don't know, for some reason, whenever a few people get sick, by the time it reaches you, it's really bad. So I called in and I told my principal I can't make it. And And so I had to take the day off. I couldn't get up to go to school. And that day was the funeral for the elder. So I couldn't go to the funeral. My wife went. And you know, you can tell when you're really sick. And I wanted to tell my wife not to leave, but I said, you know, somebody has to go and represent us. So she went. And about 10 minutes after she left, oh, I felt like I was going to die. But I knew what to do. But I couldn't do it myself. So as soon as she came, I said, honey, please do a fomentation to my spine. My sinuses were blocked and I was feeling, I can't describe it. But all I can tell you is from the time she put that heat in my back, the sinus cleared up. My sinuses opened up and I started feeling better. But what has happened? What happened was the Thursday night. I started actually getting sick from the Thursday, and I did a hot foot bath, which I'm going to show you. But my wife was pregnant, and it was winter. And somehow pregnant women, they have a tendency to be very hot. So she had the windows open. And when I came out of the hot foot bath, all I had on was my shorts and a t-shirt. And as soon as I walked into the bedroom, I felt that draft. So I got a relapse. And the relapse is worse than the initial cold or flu, whatever it is. So that is what hit me the next day. And that's what happened. But again, hot and cold fomentation to the spine. You know, usually people that die from a flu or a cold, well, it's mostly from the flu, is because of what's called a cytokine storm. Another time I'll get into that. But what happens is that your immune system becomes really overactive. And that becomes very dangerous. So anyway, so what I'm going to do now, instead of me doing it, I'm going to ask someone to come up and do the action. Perform the action for the fomentation. Sis, you look very enthusiastic. Yeah. Yeah, since you had the experience. All right. Yes. So this is our pot with the hot water, and it's sitting right here on the stove. Boy, you were sitting on this hot stove.
Yeah.
On the hot seat. So so what's the first thing we're gonna do?
I'm gonna fix the towel.
Yes. All along the spine.
Okay, spread the towel along the spine.
Yeah. Remember, we want the 4 layers.
Oh, the 4 layers. So I am going to do something like this.
Yeah.
And then
Oh, sorry. Is the camera?
Another one like this. Right? 4 layers.
Yes. Good. Yeah. Perfect.
Should I go horizontal or
Yeah. You want it? Yeah. Okay. So it's on the spine, the whole spine, right? And now this
That's
will
the dry
be.
one, right?
This is the dry one,
Yes.
and you're gonna go and do this in the pot of hot water. I'll hold the pot for you.
Yeah. I think I must have something like this.
Yeah. Yeah, just roll it. Yeah.
Roll it. Roll it. And then
Twist it.
twist it.
Yeah.
Twist it. I'm learning. Wait. I come to school.
They're like an expert.
Oh yeah.
Yeah, women has a way of handling these things different.
Okay. And then
I just dip it in.
Dip it. And pull. Yeah, pull it now. Yes. Bring out the water. Okay. Yeah, now you're gonna put it on his back now.
so
All right. Now remember, let me just show you something here quickly. Try not to do too much handling of it, right?
Because it's hot.
And it's gonna, the heat is gonna escape too.
So,
yeah, so right.
keep it.
Yeah, so you can, yeah. All right, so pretend that you have on gloves and kind of open it out like this.
Okay.
All right.
Open it out like this.
Yes, and you put it in the back now, all along the spine. Yes.
Oh, sorry.
It's too hot. Okay, that's too hot. And this is a small towel, so we're not getting the doom.
What about, shall she burn you?
See, he has no hair in his head, so some of the water spill out there.
And this is my dry.
Yeah, dry to cover. Okay, and then you put your plastic, and then you put blanket. Cover the blanket, okay, because you want to keep it alive.
So basically the same thing, but just you lengthen
There's
it.
extra layers for the one to the spine.
Not necessarily. As long as you want enough to give it the right heat.
Because you say put the blanket.
Oh no, the blanket covers, and that helps to keep in the moisture. Okay, so put that there. Okay. So you do the same hot and cold, 3 minutes hot.
Same 3 minutes interval.
Yes, 3 minutes hot. Say it again.
5 cycles.
Yes. Yeah, good 20 minutes. You just the brisk rub. Yeah. And that's yeah. And then now, so we've done this, the 5 cycles of the hot and the cold, and then now you're gonna finish it. So I'm gonna remove this, and you're gonna just do the final brisk rub. And then you dry it. Dry it. And always remember to pray before you do this.
Amen.
Because healing comes from God.
Amen.
And then I'm going to give him a treat, give him a nice back rub. Yeah. Okay, give him a nice back rub, and he falls asleep.
Is there any particular way with your rub?
Yeah. Down. And then you pull down. Maybe have fingers together. And what do you do from the heel to the tip of your fingers, and you go.
Do you need to warm up the fingers?
Along the spine, not on the spine itself, just along. And it helps with the circulation and all that.
Do you need to warm the hand up first?
Yeah, you can put some oil, almond oil. Okay, but that's for another class. Okay, you can get it now. How you feel? That was feeling so good, right? Look, he's about to fall asleep.
Oh man. Yeah.
Yeah, come later. Come, brother, come. Yeah, come, brother. Yeah, come on. Yeah, I can talk while I'm giving you a treat. Yeah. So
So question.
Yeah.
I'm gonna try a monkey in the ring.
Okay.
If it's a female and you're a man.
Say it again.
If the opposite sex. Opposite sex.
All right, we'll come to that in a minute.
So I got a question.
Okay.
So that is from pain.
No, this is for the cold or the flu. If you're having a cold, you're having a flu, sinus congestion, all of that.
So what about if someone puts a...
Okay, you can go, bro. Yeah. Okay, let's talk a little bit more about this. And then we're going to get to the male and female question. Let's say the person has an asthma attack. Yeah, the person is having an asthma attack. You call the ambulance. And, it may take a little while. You leaving? Okay, you call the ambulance, and while you're waiting for the ambulance to come, you can apply a hot and cold fomentation to the back and the chest. I've seen situations where by the time the ambulance came, the person was doing better. Yeah. I remember in '96, I was in Trinidad and Tobago, and a very famous radio announcer. Was it radio? Yeah, I think it was radio. He was very well known in Trinidad for his work. He died of an asthma attack. The story was, he went to the city hospital, and the city hospital was on strike. So he was turned away. He went to the Adventist hospital, and whatever equipment they used to treat an asthma attack wasn't working. And that bothered me, because no person should die from an asthma attack. There's absolutely no way, especially the Adventist hospital, that should know about these remedies. But he died, you know, and there's absolutely no reason for that to happen, because his life could have been saved by applying hot and cold fermentations. And I've seen that. I've seen that done. It may take longer than just dealing with the regular. You know, it may take longer than usual, but I've seen it work. Yeah.
Question. I know a lot of people don't use these things anymore, but is hot water bottle appropriate for that situation?
When I had COVID, that's what I used. The first night when I was having breathing problems, I was by myself. I filled it and I laid on it on my back for 20 minutes. I didn't do the hot and cold, I couldn't, but I just used the heat, just to open up my airways and so I can breathe a little better. And then I did 20 minutes on my back, and then
So you
put
lie on it?
yeah, I lay on it, and 20 minutes on my chest.
Did you put anything over before you put it on the back?
No, it wasn't that hot. I had on a t-shirt, and I lay on the t-shirt. Because, you know, it's not as hot as when you do the regular thing.
So you do that.
Yeah.
Could this be done on kids?
I'm sorry?
Could it be done on kids?
Yeah. Yeah, just be careful. Yeah. But it's like I said, you know, you have congestion, you have a chest cold. Yeah. You have a chest cold. It's one of the best ways to deal with a chest cold is doing a hot and cold fermentation. So the chest, you can do the back, or you can do it to the back and chest at the same time. That works better. And what even makes it even better is while you're doing that, you're doing a hot foot bath at the same time. And I've seen all kinds of miracles happen with respiratory problems doing the fermentation to the back and chest. Yeah.
Do you have to wait till you're sick for you to do the one for your back if you have the cold, or can you do it like you enter into the flu season?
Yeah, it's just good preventative, so you can do it. You don't have to wait till you're sick. Once you know that there's a susceptibility, you can do it as a preventative method. Now, the hot foot bath, let me show you this one here now. And because I mentioned to you, doing the hot and cold fermentation to the back and chest, along with a hot foot bath, that's such an excellent way to increase immune activity and to overcome the cold or the flu. Yeah.
Could you do any of these when you're pregnant? Because I know it was questionable.
Yeah. Well, not all of them. You know, I don't think the question ever came up, and I'm trying to think if we have ever. I think
I've read it before, and it wasn't like you can do it, so I wasn't sure.
It was contraindicated.
Yeah.
Yeah. Well, if that, because a lot of things anything that can cause increased uterine activity, you wanna avoid. Yes. Then there are herbs that you can use even while the person is pregnant and they're sick. You can do. I can tell you some experiences where the person, you know, well, I'll just leave that. But you know, there are ways you can take care of your health under any circumstances. That includes pregnancy. But a hot foot bath, especially, that's one thing I wouldn't do.
Yeah.
You know. Anything that will increase uterine activity. Okay, 1, 2, 3. Yeah.
I would say, because somebody was asking if you could do it without you being sick. Is this a way of building your immune?
Yes, that's one of the things I have. Okay. Whenever you apply heat, it increases white blood cell activity. Yeah.
What about a person who lost function in one lung? Is anything that...
If the lost, that's a question I would like to answer in a different setting. But I've never dealt with a person or heard any testimonies from anyone who did it when they were... if they're functioning on one lung, but the other lung is affected. Yeah, there's a lot of... There's an answer to the question, but there's certain situations that you want to be aware of first. Yeah. Now, let's say you get an accident or something, you lose function in your lung, you need to get to a hospital. Yeah, you need to get medical help. So yeah, there's certain situations like that when you need to get medical help. Yeah.
What about the person who pull a muscle?
Okay, when you pull a muscle, like I said, you need to check. There are certain kinds of treatments that you don't do with pull muscle or sprains. There's sometimes when you don't do heat, sometimes when you don't do cold. You just need to know which is the one that's necessary. Yeah, because sometimes, yeah, remember we read a statement. It says, I forgot. I think it's one before. It's important to know the principles and when to apply them, because you could cause harm rather than good if it's done the wrong way, the wrong time. Okay. So here's a question about. Yes, go ahead.
Yeah, because as you know, the world is now becoming so health conscious and all these things. So in the event where you are given medication for the pain, or you're given something for your sinus, do you still encourage that you go ahead and can do the hydrotherapy along with the use of the medication?
Yeah, because the medication is something being done internally. So yeah, because we don't tell people to stop using their medication. That's the doctor's job. Yeah, and the person's choice. So, but hydrotherapy, I can't think of any situation where hydrotherapy would not be advisable when a person. Now, there are certain conditions, like for example, like the hot foot bath that I'm going to share with you. If a person is diabetic, you don't do that. Or hardening of the arteries of the lower extremities, you wouldn't do that. This is excellent for pain, for swelling, for respiratory problems, for the cold, asthma, congestion, all those things. During the heightening of the COVID crisis, a lot of people would call me and I'll recommend when they tell me about there are people that were sent home. So they were sent home, the doctor sent them home, they were sent home from the hospital, and they were still having this breathing problems. And I will recommend doing hydrotherapy. And that has helped. And I share with you my experience personally that worked. Okay, so there's a question. Can a male do this on a female and vice versa? I will answer that question with a question. Suppose you're someplace, you're a female, and you're someplace, and let's say you're having whatever it is, and the only person available to help you is a male practitioner. What would you do? And vice versa, if you're a male and the only practitioner that's available is a female, what do you do? And you take that and you answer the question.
My question here, doctor, because there was a conversation about a young lady this morning.
Yeah.
She has a daughter, and her daughter needs medical help. But we know a very good pediatrician, which is a male.
Yeah.
Family doctor for years. Now she's saying she doesn't want her daughter to go to a female doctor. Growing up, it didn't really matter who were in front of us. We said, take care of me. Yeah. But I understand, what has been happening.
Yeah.
For me personally, it doesn't matter whether. Recently I went for, I was sharing it this morning too, I went for my gynecologist. It's a male. And I'm very handsome and all these things. Nice. Muscular, And I felt a little I felt a little uncomfortable because I started,
Yeah.
kind of like, but, when it comes to the moment, for me to, to the pups there, a female came in the room. So I just say, my take on this, doctor, is that if you don't feel comfortable,
exactly.
then don't.
Right. And you don't want to be in any compromising situations. Like, I minister to a lot of females, but I would not go by myself. It's dangerous. You have to be very careful. And there are times when I would get calls and I would always pray. And the Lord will, through His Spirit, will say yes or no, or don't go by yourself. And I just obey that voice. Because we live in an evil world. Satan is on. I've heard people got into situations, and you only hear one side of the story, so you don't know what's the full detail. People get upset with you, and so when I was naive in the past, and I did some things that I wouldn't do now. I entered into some situations to help people, but I wouldn't do it now because of what I've heard, and you become wiser. Yes, and so we have to be wise as serpents and harmless as doves. Be careful. Like I said, you don't feel comfortable if you have choices. My wife was always, we'd always prefer a person of the same sex, but I remember one time she was very sick, and we went to the hospital, and the doctor that took care of her was male, and that was fine, It wasn't anything to...
You were in the room?
Yes, yeah.
So when there's someone present.
Yeah. So it's all about how we think, how we view things, how we perceive things, and where we think God is leading us. I had a friend, her mom was sick. I'm sorry, 1 second, Dion. Her mom was sick, and she wanted my wife to go to Jamaica to take care of her mom. Well, that would never happen. So my wife is not going anywhere without me. And she said, no, I only want a female around my mom. I'm so sorry. I'm not criticizing her. That's fine. We all have the right to think and choose. But that was her stand, and I admire her for her stand. I just felt bad that her mother couldn't be helped because of that. Yes, Dion?
I said that I'm sitting there and I'm listening. We have a far way to go. Very far. And I'm saying this, and I'm not here for anybody to agree with me, but what I'm saying, I am saying, as Seventh-day Adventists, we have to move away from certain practice. Because when you look at the world now, females are gay, men too. Now you prefer a female doctor. Wow. And you go in there, and the next thing you know, the same I don't want no male. I want a female doctor. And the same female doctor is doing worse than the male doctor. We have to trust God. And if your life is hid in Christ, He will direct and He will grant you favor.
Yes.
If you want to be well, oh Father, please help me to be well. And still you stand up here, but I don't want a man, I want a woman. You want to feel well or not?
That's like...
It's Jesus.
That's like... Go ahead.
Jesus, you're going to the same male, right? If it's not His will, you're not healed. Go with the understanding that is not the doctor, is faith. I am not saying everybody should say what I'm saying. I'm saying I'm not here for nobody to agree. But I'm saying, as Seventh-day Adventists, we need to move after uncertainty, right? But it's on everybody have their choice. They create their own choice to make. But you go to God, Lord, I am not feeling well, and I want to call Dr. Silas. Now, if there is nobody else, you tell me, I'm going to stay there and punish because there is no female doctor. No, I don't think so. And if God tell me go, if God said come, get up, I want you to go to Japan, to China, wherever God wants us to go, we have to listen to God's voice and move. Because I'm not going to sit down feeling sick. Personally, me, I don't care if you be a Chinese doctor, a man or a woman. All I'm asking God, work in this individual, whatever mindset they have, that it turn to something. As you there lying or you can't talk, tell them about Jesus.
Yeah. Yes, you want.
No, I was saying that I think you answered the question and the situation. I think part of the issue is that I think we have counsel from the Spirit of Prophecy talking about that very thing, about males should with males and females. So it's not an arbitrary, it's not something arbitrary that people are saying. But under the circumstances, if you're dying, then and God sends a male, then it's a male. But in general speaking, God is saying to His people, just like you said, that we must be wise as serpents, and because Satan sets traps. So we just because I am a practitioner, I am a medical missionary, then I must go into every situation. No, I must seek and also follow the counsel, the general counsel of God. So it's not arbitrary.
No, it's not. And a lot of there are a lot of principles that are brought out in the Spirit of Prophecy and in the Bible, and sometimes we interpret and our perception is based on our upbringing, our culture, and so forth. It's like the same situation with eating fruits and vegetables. There's some people they will not eat they'll not eat ketchup with potato because the ketchup is the tomato is a fruit, and things like those. Sometimes we can go to the extreme. There are principles to follow, and there are the ideals, and
that is why I was saying, if your life is in you, I never said nobody should run off without God.
No.
I'm not saying you're attacking, but I'm just saying, we have to have, once we are doing God, you're listening to the voice of God, you're not going to run into a situation, but let God direct, like how yes, somebody called, they sick, you don't just grab your bag and go, I have to go. You see God direction.
Yes.
Sometimes we're so sick our brain shut down. You don't even remember that you're supposed to pray.
Right, exactly.
You're so sick, you're so afraid. You don't even remember that you're supposed to pray. And whoever come by, the person is going to help. But then there's times when if you have a choice. For me, if I have a choice.
Right.
I know what the servant of the Lord says, male with male, female with female. But sometimes from experience, if I have a choice, I will choose a male to deal with me. Yes. Because sometimes us women, we are so rough with one another. I remember going to the hospital giving birth, these female nurses, they are so rough.
Yeah, I've heard that.
I think that they will be more gentle with you because they know. Some of these older women, they are so rough. I said, man, yes, they're so rough.
I've heard that before.
The male nurse are way more gentle. So from experience, I would prefer a male gynecologist. I don't want no woman touching me. So I'm saying yes, I don't want them touching me. So I'm saying if I have a choice, I would prefer a male. If I'm going for a massage or whatever, I prefer a man. Yes. From experience, women, they're too rough. Especially
no empathy.
No, that's my experience. Men are so much gentler with you.
Okay. How would you treat condition when sternum is broken and they can only take narcotics and so forth? Can they use hydrotherapy as well to?
I think you can. That's a here's the thing. And this is me. From the time I came, there was a point in my life when I said, Lord, if I can't trust you 100%, I can't trust you at all. There's situations, okay, you have a broken sternum, you're out in the middle of nowhere, and then, but you have to do something. I would apply the hydrotherapy if there's no other choice. In a situation like that, if there's a choice, I will call an ambulance. But if there's no situation, I think that's something that will be productive. Yeah. I'll tell you a story. I was playing with my son. I don't remember how old he was, but he jumped on my chest. You want to see? Okay. I'm working on it fast, so don't worry. Yeah. Right there. So I went. So months went by. I felt something. I felt something happen right here in my sternum. Months went by, and then it started to get worse. So bad that I knew something was broken. But so bad that if I turn this way, it will hurt. If I press here, it will hurt. And I'm thinking, I have to go and see a specialist. Something has happened there. But if you're like me, I'm reluctant. I'm praying. I'm saying, Lord, and I'm putting it off. Anyway, so I happen to be gone somewhere to minister to this man who was very sick. I stayed in a hotel because there wasn't any room in the house for me. So the wife will come and pick me up every day for me to go and do the hydro and massage and stuff. And I wanted for a long time to do raw. I've done raw over the years, but I just I was going through this period in my life and I wanted to do raw. And I thought that's a good opportunity. There's no kitchen for me to cook. So the wife said, well, how are you going to eat? I said, just bring me a lot of fruits and vegetables and some Ezekiel bread with almond butter and fruit spread. That's my dessert. So I will eat 2 bowls of grapes and apples at breakfast, a lot of fruits, and then I'll have a sandwich with the Ezekiel 4-9 bread with the almond butter and the jelly. Gotta have the almond butter and the fruit spread, not the jelly, the fruit spread. Well, Friday morning, this was Sunday, I started, and then for lunch will be a fruit salad, a vegetable salad, a lot of green vegetables. I was eating kale and spinach, all that raw. And then I'll have my Ezekiel 4-9 bread with the fruit spread and the almond butter. Friday, I was laying in my bed in the hotel and I reached over to pick up my laptop. And as I'm reaching over, I caught myself and I said, wait, I'm not supposed to be doing this. What am I doing? But I realized there was no pain. And I said, wait a minute. And I turned the other side. There was no pain. And I pressed and there was no pain. And then I'm thinking, what happened? And then the only thing different I remember doing was the raw. It disappeared completely. Just from doing the raw. Whatever was going on in there healed up. Yes, you do.
Okay, so the person I was talking about was me. A patient came to my care several times and broke my sternum, right? And over some time, it was okay. But then knowing that if I should lift somebody or lift something, I will get secondaritis where everything is inflamed. So how do you...
the hydrotherapy, I will try the hydrotherapy. There's also some herbs that I would recommend. So you can talk to me after. Yeah, because it hasn't healed completely. And it's probably getting worse. Yeah, yeah. So, and what happens with injuries like those, you need months of recuperation. Months without lifting or certain types of movement for it to heal. So it hasn't really, yes?
Can hydrotherapy help someone with scoliosis?
It will help the inflammation. If there is pain, it will help, but it wouldn't set the spine back in shape. One of the things that I found that helped, because I have scoliosis, I never knew until I was 17. I always wondered why it is. Every time I go to the tailor, he couldn't get the hems right. it was a mystery. They do one, he measures it correctly, and when I put the pants on, it always, and one day, I was about 17 years old, and I think, and I just brought the pants from the tailor, and I stood in front of the mirror, I didn't have on a shirt, and then I looked in the mirror and I realized that one hip is longer than the other.
You want it right?
Yeah, the one is on the right. And then, I was talking with my mom, and she said, yeah, when I was pregnant with you, I fell, and maybe that's what happened. So then I realized, and then I learned about the term scoliosis. There was a slight curvature in my spine. What I found that really helped me is an exercise where you stand on the wall. You stand on the wall with your hands like this, and you stand like about a foot away, and then you gradually bring yourself back up. You know, you stand like a foot away, and then you gradually bring yourself up, but your hand is back on the wall. And I would do that frequently, and I will feel a difference. But yeah, that's a curvature in the spine, and there's no herb that really correct that. But you can, if it's painful or if it's uncomfortable, you can do that. It helps to correct. You bring some correction to the. Yeah.
But having said that.
Okay. You're leaving. Okay. Okay. All right. Yeah. That's my faithful friend and sister.
You're coming so I could show you what I'm talking about.
Yeah.
Then you're going to go behind. Come right there. Go behind here. Put a knot right. See behind. Put a hand. Put a knot right there.
Oh wow.
Right. Now you can tell him.
Sit.
No, that's it. That has been there a while, and I'm asking, how do I get that?
Did you have an injury or something?
Never an accident, never.
And when did that start happening?
Good question.
Yeah, is it growing?
Not to my knowledge.
Okay. Yeah, you should get it checked out. Yeah. Yeah, you should get it checked out, at least to know what's going on. If it was growing, I would say, well, yeah, this is something very serious. But if it's not, or maybe growing slightly. Yeah, yeah, it feels like I forgot what it is, a fatty tumor. But you should check it out though, and see to make sure. Okay. I think they eased up on that. Yeah, but I have I'm gonna get a number for a friend of mine who's a physician. Yeah. Then but I'll definitely check it out.
I got a doctor close to me.
Okay. Okay, good. Okay. All right, I hear that. Oh, you know, you mentioning that, and that's what I was starting to say. You know, the way I think, and that's me. I would take my chances with God, unless as long as I know what's going on. I've experienced some things in my life that people will say you're crazy, but I because of certain fears, I stood and asked the Lord to do it for me. I said, Lord, whatever it is needed for you to save my life, I know you can do it. And I stood right there and ask him to do it. And miracles happen. Miracles happen. I tell you, you know, a time is coming when we need those miracles.
Time is close to me right here.
It's right here. Opportunities are going to come our way to trust God 100%. Or not to trust him at all. And where it comes to sickness, I can share some stories, but we don't have time. But anyway, let's talk about the hot foot bath now. Now, this is one of the best ways to abort or prevent a cold or flu. It's called a hot foot bath. Hot foot bath. And as the name implies, it is a hot foot bath. And how you do a hot foot bath, you can do this laying down or you can do it sitting. what you do is, and again, this is another remedy everyone should be ready to do in their home, apply in their home. You'll save yourself a lot of time off from work, visits to the doctor, and money in medicines. So how it is done? You sit in a chair. Okay, so I need somebody.
Sit there.
No, he's operating the camera. Got him out of it. Okay, good. Yeah. All right. So. You size 13? Oh, okay, good. Good. See, that's it. So it's always good to have another head. No, you're not gonna always have the ideal situation. So if that's all he had, he's gonna have to make it work. Yeah, get some masking tape, not masking tape, and tape your toes up. Okay. So the ideal thing, this is kind of shallow. It's always good to have it at least right 6. You want to water at least 6 inches above your ankle. But I've done hydrotherapy. Yeah, I've done hot foot bath. You know the pants that they give you in the hospital? I've done hot foot baths with that. Remember, God is not limited. What's in thine hand. You know, you don't have to have the right things. You know, the principle, right? So this can fit a size 13 feet. And you can find, if you go to the discount store, you get a lot of different sizes of buckets. So you fill this with.
Question.
Yeah.
Variety is a spice of life. Okay. As far as application, you know what time is coming when.
Yeah.
When we able to, those who can involve in medical missionary work, we're going to find employment everywhere.
Yeah.
And these are some of the methods we're going to be using.
Yes. Yeah, these are the things that we're going to be using.
Right.
And so that's why I want to encourage you to go home and practice this. So you can get the feel of it, you can get familiar with it, and you have any questions, you call me. I usually tell people, I've done Zoom meetings with people doing this so that I can instruct them and help them to do. But please go and try it. Don't wait till a situation comes up. Then you have to be thinking, well, how do I do this? Do it now. Okay, so the water, so you put the feet down. Now, I asked them to bring me a blanket, but they didn't bring a blanket.
I have a sheet.
I have a sheet, oh good. Well, let's get the sheet. Okay, so you put a sheet first. You can stand up. Okay. So thank you. So you start with a sheet, and then you put a blanket. No. You put the sheet first. No, you put a blanket first, or a comforter. The warmer, the better. Thick, yeah. And then after that, you put the sheet over that, over your blanket or comforter. You can sit now. Wait, sorry. And then you sit down, and then you drape the person. And then you start with a medium heat, and then you ask the person to put their feet in the bucket. Go ahead.
Try the whole shoe.
How is that? Is that warm enough?
It's okay.
Okay, put the next one.
So
okay.
You're doing both feet.
Yeah, both feet. And your blanket and your sheet and all that must drape the bucket or the basin. Okay? Yeah, lock the heat in. Now, one of the things that I discovered that will work good is I will put a shower curtain over the person. And that's like a little mini steam bath. Oh man, that works so good. Yeah.
There is this little portable sauna. Would that work?
It's not deep enough.
No, it's something that you.
Oh yeah, yeah. Oh, the portable.
person.
Oh, the portable sauna. Yeah. The portable sauna.
For situations like
Yeah.
this, if you wanted to do that.
But the thing is, with the hot foot bath, you want it.
Access.
If you want the general, you can use the portable sauna, and that works too. But I find, but the reason why you want the hot foot bath, because you want, this is specific. A hot foot bath increases the, when you put hot heat to the feet, it increases circulation in the pelvic area and the upper and lower respiratory areas. So you have a young lady who is going through menstruation and she's having pain and cramps, this will bring relief. I've seen this work wonders, right? Because it opens the circulation in the pelvic area and it removes the congestion. Okay? So all you young ladies should practice this. Those of you who are, well, let me not say young ladies, all those who are still going through having a menstrual cycle. Yes? Say it again. Oh, well, I'm glad you mentioned that. It's the best way we have seen relief in endometriosis. Besides medication, this is one of the ways I've seen this work. I remember, yeah.
So you don't have to use medication.
One teacher.
I'm sorry, say it again.
If you're doing this, do you still have to use medication?
If you're doing a painkiller, I've seen where the person did not have to use the painkiller because this relieved the pain. Okay, and so come back to the shower curtain. When you put when you put on the sheet, you put the shower curtain over the sheet, and then you pour the blanket or comforter over the shower curtain. And the shower curtain helps to keep in the heat and the moisture. Your body warms up better, and you perspire more. Another way, if you're catching a flu or a cold, this is the quickest way to abort it. All right. Sometimes even with congestion in the chest, I've seen this work also. You're having a chill. Do this. This warms up the body.
And what about COVID?
Yeah. What about the compost and the pens?
Well, we come to that. Yeah. Yes, you can do that also in any situation like that where it's respiratory issues. And so after the feet in the water, you check, make sure the temperature is good, and then after maybe 5 minutes, you apply a cold compress to the forehead. That keeps the head from getting cool. Getting too hot. And all of that helps. A lot of times I do it. I didn't use a cold compress, but it's in the textbooks will tell you recommend a cold compress. So then after a few minutes, you
could use those cold packs, right?
Yeah. You ask the person, how was the heat? If it's starting to get cold, then you add more. More hot water.
You just take enough from it, just add into it.
Add into it. Now, if I'm doing, there are times when I will, like, if let's say, for some reason or other, the water is cooling down fast, I will just dip out. Once it reaches a certain level, I just dip out some of the water from the bucket, and then I'll just add more. Right. Okay. So, and some people, people will ask me what temperature. The textbook gives you its temperature. What I've found is that people can tolerate different temperatures.
Right, true.
People's tolerance are different. So I always start with a mild temperature, and then I'll keep adding until it's comfortable for them, but still hot. Yeah.
And you do this for 20 minutes?
Yeah, you do this for 20 minutes. I've done it for 45 minutes because sometimes 20 minutes and the person doesn't perspire, which may be indicating that their body's not warmed up enough. There's so many different things, the temperature in the atmosphere, all that could determine things going on in their body. I remember one man, we did this. His wife called me and she was trying to convince him about natural healing. And he wasn't a believer. And one day she called me and she said, I have a good opportunity. He's home from work, he has a bad cold, he caught the flu. Could you come and do something for him? So I came, gave him the hot foot bath. He did not sweat one drop.
We'll see.
And I did a massage, and after that, nothing. She called me 2 hours later, and she said, after you left, about 20 minutes later, my husband broke out into a sweat. So much that after that, he felt better and he went to work. So I really wish you never came. Because she was hoping that by him being sick at home, she will have him to herself for that day. But her brother felt, yeah. She said, I wish you didn't come.
So, Dr. Silas,
yeah.
when you, after about 20 minutes when you take your food out the hot water, you just dried off and go.
No, hold on, not yet. We didn't reach the finishing yet. So, but I'm saying he didn't perspire. I've dealt with people who, after the first and second time, they didn't perspire. But the third time I did it, the pores opened up and they were sweat profusely. If I'm doing a hot foot bath for myself, and I'll tell you how I do it for myself. If I'm doing it in 20 minutes and I'm not perspiring, I will keep going. And as soon as I start breaking into a sweat, I will stop. Sometimes you do it and you just, after 5 minutes, water will be pouring off you. So, but nevertheless, the job will still have been done. But when you get a good sweat after this, you know that you've had a good treatment. That worked. Say it again? Yeah, let me see. How you feel? Oh man, yeah, water's pouring down his back, yeah. So it's nice and good. Your feet too, right? Oh, how is the heat? It's good? Okay, well, 20 minutes are up. So what are we going to do? Yeah.
Is this equivalent to a personal sauna?
No, it's not the same.
Okay. Is it better? Which one is better?
This is what I prefer if I'm having a cold or a flu, because this is direct, this is more specific. Yeah. If I just want to do a general detox or something like that, I will do a sauna. Yeah.
What's the difference between this and a contrast shower?
Well, it's just that you're applying heat to the feet. Yeah. You're applying heat to the feet, and you're just doing heat.
Because since this COVID began,
yeah,
every single week, every single week I take 2 contrast showers. I haven't gotten a sniffle.
Yeah, once you do that frequently, you would not catch a cold that easily.
I haven't gotten a sniffle.
Yeah.
So you want a sniffle?
This has never happened before. It has never happened before. I'm just saying it works.
Yeah. Well, yeah, if I'm going to do this, I'm sorry, sir.
No, I'm just saying, I ain't never get a sniffle, so I'm saying it works.
Yeah, it works, yeah. I've been doing this for many years. Every day, every time I have a shower, it's a hot and cold shower. Every morning.
Brother Shane, you do that from the head or just the body?
The head, the whole.
The head down?
Yeah.
Or your face? Oh.
I don't know if you wet my hair all the time.
Yeah, I do it from the head. I do it from the head down, and that's every day. The hot and cold. I do the 50 minutes hot, 10 minutes hot, and then I end with the cold. But with the contrast is a little different. But
all this hydrotherapy.
Yes, it's still high. No, some people go in the shower and they spend 15 minutes on a hot shower. That's not really good. And then they come. Yeah, it's not really. Yeah, you need to get up.
Yeah. It's 3 minutes hot and 5 minutes hot and 3 minutes cold, is it?
What's that?
For the hot and cold contrast shower.
3 minutes hot.
3 minutes hot, 5 minutes cold?
No, 10 seconds. That's how I do it.
Yeah. I do 3 minutes hot and 30 seconds.
That's like 30 seconds cold. Yeah. Yeah.
And on cold.
Yeah, I've never really looked at the time.
Yeah. So used to it.
Yeah. I just go, and I just do the one, if I'm in the shower for 10 minutes or 5 minutes, I take quick showers. I take quick showers. Some people, they like to stand there for, I'm not one of those people just like to stand in the shower. I clean my butt, throw up and all that quick, and I'm out of there.
It dries your skin too?
Yeah.
And then when you come out, then you go in the cold.
It's not good for the heart either.
Want the hot shower?
Yeah, cold water is better for the heart. Yeah. So anyway, so after we've done, we're gonna pour. Where's our cold water thing? We had this cold water thing. You remove the blankets and sheets and everything, and you pour. You lift one foot at a time. Pour the cold water, and then you dry it, but you don't put it back in. You dry it and you take it out. And then you do the other one, dry it and take it out.
Just pour it over the foot?
Yeah, the areas that were in the cold water. Now the only time you wouldn't pour cold water is if the person has high blood pressure.
Or if you have communion.
Yeah, or if you have communion, yeah. And then you wring it out. If the person has high blood pressure, you wring it out, and then you just briskly rub. Right. You don't want anything that will shock the person. You know. So, and that's it. And then you go and lay down for 30 minutes. Very important. Yeah, go and lay down covered. Sometimes you may continue perspiring.
Lay down 30 minutes.
Yeah. Okay. So you're all right now? You know, your sinus clear? Good. Everything's good. A miracle happened. I remember one time I was doing this in church one Sabbath afternoon. There's a lady that was having sinus headaches and blocked sinuses, and we did that. We did a live demonstration, and by the time it was over, she was just rejoicing. Her headache was gone, and her sinuses were clear. Because it really does that. Yeah.
So you could do that in the winter?
Anytime.
And go outside?
Yeah. As long as you finish with your cold, you can go outside. Right away. Yeah, the hot and cold shower. I remember one time a co-worker of mine was coming on with the flu, and I said, yeah, I do a hot and cold shower when that happens. And she said, well, you want me to kill me a hot and cold shower because, you know, we were taught that if, yeah, you get it.
Stroke if you do though.
Yeah, that's what we taught, but, you know.
But with the hot and cold shower, you start with the cold, right?
No, hot.
Start with the cold and finish with the cold.
Cold, yeah.
Okay.
You spend more time with the
Warm,
hot.
yeah. Yeah. Okay, all right, that's it. You can go. Surgery is over.
Thank you very much, sir.
You're welcome. Yeah, and okay, and like I said, for you young ladies who are still having your menstrual cycle, this is a good way to help to bring relief. If you haven't.
Before or after or during?
During, rather, yeah.
I see someone, they allow the person to sit over the hot tub and cover them up. Are you cover that? Is that a good,
Okay, so if I'm doing this by myself, I will sit at the side of the tub. I will have my blanket and comforter right there. I sit next to the faucet. I'll have the bucket under the faucet so that I can control the heat. I can control the water. And I sit right there, get some towels and put it aside the tub so that I'll be sitting on something nice and soft instead of the hard thing. And I sit right there and do it.
So you're in the bathtub?
In the tub. Okay, take care. Yeah, yes. So I wouldn't, the first time I did it, I full up, the first 2 times I did it, I full up the tub. And then I said, wait a minute, this is too much water. So I got the bucket and I put it right there under the faucet. I put my feet in there. And that worked really well. I've never seen a hot foot bath fail me as yet. I'm catching a cold.
Fever or anything?
Yeah, I rarely catch a fever.
But if the person has a fever, you can use it?
Yeah, well, if the person has a fever, the temperature is already up. White blood cell activity is already increased. Then what you do is just keep them cool. What I would do, I will do a cold compress to the calves for 20 minutes. Let me show you how to do that. I'm one of the children. You want to be my helper? Okay, anybody? Okay, good. And 5 months later, learn a bit. Oh, sure. Yeah, this is actually a small size table. Oh my goodness. Make it do. Yes, you gotta use whatever you have available. Reduce. I think I have some herbs that can reduce your foot. Okay, now I remember reading a New York Times newspaper years ago. There was an article about fever, and the person who wrote the article that believed in evolution, and they were quoting from who it was they were quoting from. Some famous scientist who was an atheist. Was it Darwin? I don't remember. But anyway, they were quoting from how he was saying that we were evolved for fever and how it's benefits. But anyway, what we learn is that whenever the body temperature rises, chemical activity increases. And fever is basically the body's way of calling out the troops when the body is threatened by certain types of organisms. So, what I would not try to kill a fever, I will control it. Once it gets more than 102, I try to keep it at 102 because it's nature's way of bringing out of increasing white blood cell activity. So if it gets too hot, gets 102, I've heard doctors say 102, 103 is fine, but I just stick to 102, and what I do is control it, don't destroy it. So I would wring out a towel. I usually would use a towel. Sometimes I've used t-shirts, in situations, use what you have. And you're working on the calf. The calf is back here between here and here, right? So you wring this out in cold water. All right?
Ice cold?
And it doesn't have to be ice cold. I've never used ice cold, just the cold water from the tap. I wring it out, and then I wrap it around the calves, on both calves. Pin it, and then I will get I will cut open one of those plastic shopping bags, and I will wrap it around here. All I have to keep in the heat. Well, it's going to get warm. This is actually called a hot compress, a warm compress. It's going to get cold in an effort to deal with the heat. So, and then you wrap something else, and you make sure you pin it and keep it there nice and good. And after 20 minutes, you check the temperature. Let's say the temperature, you started out at 103, and it comes down to 102. After 20 minutes, you stop. If it didn't, you do it again. And you do it on both calves. All right? And while you're doing this, another thing you're going to do is a cold compress to the forearm. Now this is clean, so you don't have to worry. Okay? It's good. I practice keeping a cold compress to the forehead anyway when there's a fever. But this is how I would deal with fevers, control the temperature. Now the thing is with children, very small children, they don't like to keep anything cold on their forehead, so usually you'll have some difficulty. Yeah.
Can you put it between the thighs since the temperature will come down way faster?
Well, no, I really don't know. I don't know. I've never thought about that, and I've never read that. But I know that the calf is where that's recommended. Maybe worth a try, and come back and report to us. Yeah.
I came in a bit late. So the patient has fever?
Yeah.
Okay. So how would you know when it is under temperature, when it is normalized now?
You use a thermometer.
Okay.
Here's what I've done.
That's 1 degree then?
Yeah. 100. Once it starts to get below 102,
1 degree is about it.
it's getting too cold. Yeah, for fever. Yeah.
The reason why asked you is because
Okay.
this is what I didn't know before.
You're good now. Yeah.
That is comfortable.
You're comfortable. Yeah. Yes.
The reason why I asked you is because this is a knowledge
Thank you so
I
much.
have, that having a fever is a good thing. Having a high temperature is a good thing, but a fever is a bad thing. And then now when we bring it down the fever, we tend to bring it down cold, too low, which is not good.
Right.
So that's why I asked the question. So a lot of us can say, okay, cut the fever, period, but it is good to have a temperature going.
Yeah, because that's the body's way of fighting that infection. Now, so what I would do when there's a fever, I will do this, and I would also, I'll drink golden seal, or not echinacea, because the echinacea is going to stimulate white blood cell activity, and the fever is already doing that, so you don't want too much. So I will do usnea. I think I told you guys about usnea. To whatever infection I'm fighting, that will help, to hasten it along. So yeah, but echinacea, it's not recommended to do echinacea when you're having a fever.
For a child under 5, you would do that procedure, or you would?
Yeah.
Because my cousin pediatric told her to put the boy into tipping water.
Yeah.
Lay him in tipping water for a few minutes
Yes.
and stuff. Okay.
Yes, yeah. And in some places, I don't know if they still do it, but they'll put the babies in ice cold water, in a cold bath. Yeah. Another thing that I've done for fever is to take an enema. Yeah, because that helps to clean, have to do some cleaning, a warm water enema. Yes, I've done a lot of stuff. But yeah, so that's how you're going to deal with the fever. And always remember, whenever there's a fever, always try to keep the head cool. Yeah. When I was growing up, my mom they would take limacol, limacol? And they will put it on the feet, a baking soda, and lemon, all kinds of stuff like that they would do. And it worked. Okay, yeah.
Is it true if somebody's catching a stroke, you take them to the pub and cold water bath?
I've never heard about that, but it makes sense that it will work.
I've read it.
Yeah. I think it will work, but I can't tell you from experience. Yeah. And cold water. Now, that would stimulate circulation. One of the best, what I found that works better for the cold or the flu, the chest cold, the flu, and all that kind of stuff, sinus infections, is the fomentation to the back or chest with a hot foot bath at the same time. Yes, it works really good. So then is when it would be appropriate to use this instead of the bucket. I've used the bucket too, but it's a lot of work involved trying to keep your feet in there you have to bend the bucket a little bit, and you don't want the water to come out. But this will work perfectly for that, a hot foot bath. Try it, you will see. No, you're laying down. You're laying down, and your feet are on this while you're taking the fomentation. And that really
So the feet that have been slightly elevated position.
Yes, yeah, and so these are the things that are going to come in handy, and we can benefit from them now. So.
I was sharing this earlier with someone. This is just a concern that I've had for quite a while now. Because with all this knowledge, because we are here, right now this is recycling information for some people because they know already. You understand? But I believe that the admonition also of NNGY is that we take it to a community. And I just strongly believe that during all that has been happening in the pandemic and stuff, we should have a tent in the park where we have, people coming and we assisting people and giving all these lectures and giving this information. But I just don't see it happening. And it's the same, if I don't hear it here, I hear it in another church. It's just us receiving the same information, and I don't think, you know, it's right for just us alone.
Yeah, you're absolutely right. You know, I don't know what it is. I know there's a lot of logical or maybe illogical reasons why. I've met a lot of people who have gone through these medical missionary trainings and can't function, don't even know what a hot foot bath is or how to do it. And very little simple things. You know, we talk a lot about the 8 laws of health. And first of all, there are more than 8 laws of health. Or I'm going to say it goes deeper than the 8 laws of health. And we stuck on those things. And anything outside of that, you know, we lost. And we don't even, and those things are not even practiced or taught in the depth that they should. You know, because when we tell people about nutrition, that's another story by itself.
You're speaking my language right now.
Yeah, because first of all, when you go to there used to be a time when I tell a person, you know the council eat largely of fruits and vegetables and sparingly of grains, nuts and fruits. Well, I can't say that anymore, because when Ellen White gave those counsels, you can guarantee that when you go to the market and buy food, it was giving you nutrition.
That's right.
I was told by this another botanist, what do you call oh gosh, but deals with food, agriculture, food production. He was saying in the industry they don't call them food. What you go and buy in the supermarket is food-like substances. FLS. So what I've been doing, I'm about in the next couple of weeks, I'm supposed to be starting some Zoom classes showing people how they can grow foods in their house, in their apartment. Microgreens, sprouts, all those things. I hear people say, okay, you know, I'm moving to the country and we have our country homes, our country property, and when we have no food, we're gonna run. You know how long it takes to grow a crop?
You have no idea.
4 months.
But when you can do sprouts, or microgreens, you can have food in days. So, I'm sorry, this is my wife just sent me a message. Okay, yeah.
Doctor, you're on a very, very good topic. But because of the time and stuff, Doctor, I don't know if you really want to start this topic right now, you know?
Well, okay,
because when you look to it, when you talk about, I can't remember the name of it, but this, some form of chemical that they use to put on them fruits and them vegetables, they are recalling them because I found out that it causes Parkinson's disease.
Yeah, it goes deep, like you said, that goes deep. And my solution is teaching our folk how they can raise their food. Many of us, it's not realistic, it's not practical, it's not doable for us to move to the country right now and raise a garden. But you remember the Bible says, where sin abound, grace is more abound, grace did more. God has a solution for everything.
Amen.
I was telling someone, he looked down through the ages. He saw 2021. He saw COVID. He saw financial disaster where some of us can go in the country and buy our homes and buy our property, and some cannot. You know, so my wife will tell you, I don't deal with problems, I deal with solutions.
Yes.
And every situation that happened in our life in this world, I'm always thinking, okay, how are we going to solve it? How under the circumstances am I able going to survive? You know, I want to do a class on home, what I call home apothecary, where you can use seasonings that you have for medicine. Yeah, I tell people, a day is going to come when we cannot go to the health food store and buy herbs. Or they can't go to the pharmacy and buy medicine. But there's always going to be water running from your tap, if you live out in the country and you have no electricity, or you have a backyard, you can cook your food right there. I mean, you can heat up your water to take your hydrotherapy. As long as there is water and there is some way to heat it up, you have medicine. Right? And I haven't even scratched the surface on hydrotherapy. I just given you the basics. That's doable. That's more practical and easy to start with. There's so many different illnesses that you can deal with through using hydrotherapy. So it's important to learn, and that's why I'm teaching these things. That's why I've been trying to teach this for years, and I'm hoping that the story will change here with you folks. That you will go home and practice these things and report to me, well, I've done such and such. But I really want to do that Zoom. 2 years ago, my wife did it. We were doing Zoom meetings during the COVID crisis. She did a class on container gardening. She did sprouting, microgreens, and we want to do it again.
Okay.
Last year, she grew microgreens. This is the size of the windowsill. She had spinach. She has about 4 different pots that she grew food in. And you should see when she did the spinach, oh boy, when the spinach came up, you should see how much spinach was in that container. But she didn't grow them fully, she just grew them into microgreens, and that's what she was eating. She has bad foods. Right now, my wife's diet is sprouts on microgreens. And of course she uses my herbs. And if she happens to get some fruits and vegetables, my wife will tell you, I would rather get the food free than spend money in it, because of no food value. So sometimes a neighbor would bring a bag of apples or a bag of greens, something from the food bank. And what she does, what she has learned to do, she would eat it and then take my immune detox blend, and that's how she can survive not getting sick. So she told me this. I said, honey, I'm now feeling sensitivity to a lot of those things. So she said, just do what I do. Just take the stuff and drink the detox. So when I go back home, I'm going to start eating like her, doing the greens and stuff, and we're going to wrap up now. So she makes her microgreens and her sprouts. She clips them, put them in a Vitamix with soaked almonds and on my green powder. And so she eats, and she's not losing weight. In fact, she's going to the gym now. But raw, totally raw, and so it's doable. It's doable. Okay.
And what I want to say two things. You said that she's gaining weight.
Yes.
Is she on a plant-based diet?
Totally plant-based.
And she's gaining weight?
Yes.
Okay. Which means that the nutrients that she's taking in, she's doing the right thing.
Yes, and she's getting a lot of nutrients.
You should not be on a plant-based diet and be malnourished or be underweight.
Exactly.
Because that means you're lacking nutrients. Now, my concern here is with the dirt now, the soil.
We're going to have to stop now.
Yeah, I know we're closing.
We know we have to close now. We're going to sing. We're going to finish tonight.
No, Pastor, don't do that.
I'll give you my number and call me.
Yes.
No, Pastor, no. Don't do that. Let me finish what I'm saying.
The time is Minister 7.
Yes, Doctor. So what my concern is here is the soil. Because I come to the US and I see that we purchase soil to plant our fruits and vegetables. And it's my concern how healthy it is back home. And it's better if we go and dig in the dirt and take the dirt instead of purchasing the soil. So my question to you, Doctor, which is better, please?
Call me and we'll talk about it. Yeah, because it's a long explanation to that.
So I can't get an answer at this minute.
Well, I
don't like these things.
I just have to honor the time.
No,
Pastor, that is very disrespectful, and I feel very embarrassed of that. And in front of our children, I think that was very wrong for you to do, Pastor. This is information that I need right now.
Well, I was talking to her. I need the same information like you. You think I did?
Pastor? No, that's not good.
Oh, that's true? Okay.
Sis, I'm giving you the option, just call me. And we can talk about it.
I'm going to take a number, Doctor. And that's disrespectful to the presenter.
That's all right. We're going to sing a song, 2 songs. The first one is
Hymn 534.
Number 534, Tell Me the Story of Jesus. Amen.